Hello, I am Jo Brooke. I'm the Perinatal Mental Health Training and Service Development Lead within Tavistock Training and Education, which is part of North London NHS Foundation Trust. And I'm going to talk to you about our Perinatal Mental Health Postgraduate module, which is currently open to applications. So the aim of this is to help hopefully give you a clearer sense of whether this course is right for you, and then to give you all of the information you need to complete an application. I'm going to talk a little bit about the course philosophy, how it's organised and how it's delivered, the entry requirements and application process, the origins of the course and some of the feedback that we've had from students, the assessment components and credits, and how the course can support your practice and your career. Tavistock Education and Training is a pioneer in mental health, social care, management and leadership education. We train lots and lots of clinicians, such as social workers, nurses, teachers, and many more, and offer a whole range of different courses. We're the only NHS trust registered with the Office for Students, and so we're regulated to ensure that every student has a fulfilling and enriching experience of higher education. And we have a clinician tutor model and very much have a multidisciplinary approach to ensure that our courses are relevant, transformative, and empowering. In terms of our perinatal mental health training, we've supported the development of the UK's perinatal mental health workforce through the delivery of specialist continuing professional development and postgraduate training since 2017, when many of the services around England were expanding. The module was originally developed by the Trust on behalf of NHS England, which used to be known as Health Education England, and was part of a mental health workforce programme back in 2020. Since then, it's been delivered to hundreds of multidisciplinary clinicians, and for the last couple of years has been open to practitioners all across the UK. We've received consistently positive feedback from the students that have done the course, along with their managers and regional leads. In terms of how we deliver the course, it's all delivered online via Zoom, making it much easier to access and enabling you to achieve academic credit for the skills that you require within this specialist field of perinatal mental health care, and hopefully supporting your current role and enhancing your career. The beauty of the training is that you'll meet people from all around the country, and students consistently tell us that they benefit from learning alongside other clinicians in other areas and finding out how they run their services. So who's the course for? It's important to emphasise that this isn't an introductory or induction course. It's very much aimed at more experienced clinicians and beneficial for those who are currently considering a leadership role or are already within a leadership role. So the course is for professionals who are working in community perinatal mental health teams, inpatient mother and baby units, those that have specialist perinatal midwifery roles or specialist perinatal health visiting roles, those working within parent-infant mental health services, maternal mental health services, or who have specialist clinician perinatal mental health roles within family hubs and healthy baby services. So it's for a whole range of disciplines such as nurses, psychologists, psychotherapists, occupational therapists, social workers, nursery nurses, and specialist midwives and health visitors. In terms of the requirements, you need to be within a relevant full-time or part-time perinatal mental health role for the whole of the course, so for the whole duration. It's beneficial to have at least a year's experience within one of these specialist services or within your specialist role. And it's also beneficial to have completed other related CPD training beforehand, because the course very much assumes a certain level of pre-existing knowledge. Participants need to have a first degree or equivalent. If you don't have a first degree, we can consider your application by taking into account your professional experience and your previous training. The important thing is that students need to have the ability to reflect and to critically analyse in practice, because the course will pull and draw upon your clinical experience. And it's also important that you seek managerial approval for your study time. So not just for the 10 days of the course, but also for the weeks in between. In terms of our course team, we have a course lead, a course administrator, and our teaching staff are all experienced practicing clinicians from all around the country, or those that have previously worked within specialist perinatal services. They come from a whole range of backgrounds, and many of them teach on other courses within the trust as well, or elsewhere within other areas. So in terms of the course content and the course structure, the course is run over 20 weeks, and you attend for 10 days fortnightly on a Thursday. Each day is broken down into 4 parts. So the day starts with a lecture, and then we have reading seminar groups, difficult conversations seminars, and work discussion seminars. And for those, you're broken down into smaller groups. There's a real emphasis on self-directed learning in addition to attending the 10 days. And so you'll be provided with a comprehensive reading list through our online learning platform called Moodle. And you'll also be required during the course to do something called a reflective journal and to do an assignment. To support you with this, during the training, you'll have two tutorials with one of the teachers on the course to support you in embedding your learning and with preparing for your assignment. And during the 10 days, each day we cover a different theme. So we start off on day 1 looking at assessment. Day 2, we look at the mother-infant relationship and the experience of the baby. Day 3 is partners and intimate relationships. Day 4, we look at depression and anxiety. Then day 5 at bipolar disorder and psychosis, followed by personality disorder on day 6, child and adult safeguarding on day 7, pregnancy loss. Then on day 9, we look at interventions, and finish off with looking at leadership on day 10. So in terms of the course content and structure, this is a level 7 module. And as I mentioned, in terms of the assignment component of the course, you'll need to complete a weekly reflective journal, and at the end of the course, a 4,000-word assignment. You'll also need to do weekly self-directed reading and preparation for the previous the next day's trainings. When you've completed the course, if you pass, you'll receive 30 academic credits, which will be awarded by the University of Essex, which is our partnership university. And the beauty of this is the credits are transferable to other programs. So if you've got other credits from other courses, you can put them together as part of what's called the credit accumulation agreement between higher education institutions. So in terms of the course aims, the focus of the course is very much on improving the experience of women and families within the perinatal period and within perinatal services. There's a strong focus on the experience and perspective of women, infants, partners, and their families throughout the perinatal pathway. And the focus of the course is to enable and support practitioners in managing complex clinical work by learning to recognise and understand issues such as those involving difference and diversity within practice, and looking at improving understanding of assessment, risk, infant experience, relationships, and communication. In particular, we'll focus on certain mental health disorders and how they manifest in the perinatal period. And we'll encourage you to integrate current evidence and research into effective clinical practice. There'll be a strong focus on self-reflection, and we'll look at how to support you with your leadership development. and the supportive learning of others within your workplace. In terms of the learning outcomes for the course, these are broken down into 3 areas. So the first area is learning in relation to knowledge and understanding, in terms of mental disorders, their risk and treatment, theoretical ideas, best practice and research, sensitivity to considering diversity of experience and the effects of this. And then in terms of intellectual cognitive skills, the learning outcomes are in terms of describing complex work and demonstrating their application within clinical practice, being able to summarize and communicate your learning from academic papers and reflect on how this relates to your own clinical situations, and being able to communicate workplace reflection and ideas. And then the learning outcomes in terms of practical skills look at observation and self-observation, managing, describing and reflecting on complex and difficult interactions with women partners, family and colleagues, and being able to manage, describe and reflect complex and difficult interactions with colleagues. So when you start the course, we'll do a pre-course evaluation based on these learning outcomes, and then we'll do another one at the end. And when we've done these with students in the past, they've consistently shown a rate of increase in their learning objectives from the beginning to the end of the course. And when we've surveyed students a year later and asked them how they found being able to apply the course to practice, 96% of them who undertook the module in 2023 said that it continued to be beneficial to their practice. And 100% of the students who studied with us in 2023 also reported that they could align their personal career goals to the programme. With other courses, we've asked students how they've found it 6 months after finishing the course, and these are some of their reflections, where they've talked about feeling more confident since completing the course and using their knowledge in practice. They've found the course good in terms of its reflective nature, and it's enabled them to think about further training and about changing their role. They found it one of the best trainings that they could do, and have found that it very much impacted their clinical practice and knowledge. So let's just talk about the application process. So in terms of your application for the September 2026 course, it's important to complete the application with as much detail as possible. We'll then check your application and you'll be asked to provide 2 referees. They'll be sent an email asking them to provide the reference, and then we'll check these 2 references, after which we'll be able to offer you an unconditional offer. You'll then need to accept the place, and then this will lead on to your enrolment, which will be in early August. At the beginning of September, you'll then gain access to Moodle, which is our online platform, and on there will be some pre-course preparation that you'll need to do. So the application closing date is Sunday, 26th of July, but we'd really encourage you to apply in advance because course places are filling up. We run the course twice a year, so these applications are for September 2026, and we'll be running the course again in February 2027. So if for any reason your circumstances change, you can always move your application over to the next course starting in February 2027. Or if you're not quite ready to apply at the moment, because you're trying to get funding, for example, in place, or it's not quite right for you timing-wise, you can apply for the February course, and applications for that will be open from August onwards. Places cost £2,270 and will need confirmation of your funding details when you enrol. Most people who come on the course, their employer funds their place, but if you're self-funding, there is an opportunity to make the payments in 2 instalments if needed. So in terms of the training days, the course starts on the 17th of September. We have breaks at half term and at Christmas. And during that time, you'll have your first tutorial between weeks 3 and 4, which your tutor will arrange directly with you. and then your second tutorial at the end of the course on day 10. The assignment deadline will be the 18th of March 2027, which seems a very long way away at the moment, but it'll come around very quickly. And then 4 weeks after that, we'll release your marks. So if you have any queries or anything you want to ask or check out, please just use this email address, training@tavieport.ac.uk, and we'll reply to you as soon as possible. So we look forward to receiving your application and hope to see you soon on the training. Thanks very much. Bye.